Hello, everyone, and welcome back to this week's vlog. Today, I want to provide you with an update on contact tracing. Contact tracing is the process of figuring out all the people who've come in recent contact with an individual who has a communicable disease. By doing so, we can ensure people who are infected can be isolated and reduce the risk of them passing the virus to other people. Contact tracing is one of the key tools that we've been using to respond to the pandemic. AHS teams have been working very, very hard to expand our contact tracing and case investigation capacity. And thanks to these efforts, we are now seeing tremendous improvements. During the month of January, AHS case investigators and contact tracers closed more than 21,800 investigations, the highest number of investigations closed in 1 month. On January the 12th, the team closed a record high of 1,003 cases in 24 hours. This is incredible work, and my thanks go out to everyone involved. Joining me today to tell us more about contact tracing and what the team has accomplished are Dr. David Strong, who's our lead medical officer of health for communicable disease control, and Maureen Devlin, executive director for Healthy Living, Provincial Population and Public Health. So welcome to you both. David, I'm going to start with you. Can you remind us why contact tracing is so important during this past year?
Contact tracing, as you've pointed out, is something that we do all the time in public health, but it's been, again, really important within the COVID response. So just to clarify, contact tracing actually refers to quite a few functions that are kind of very much linked together. So it's case investigation, contact notification, and then monitoring. And I'll just quickly say what those are. But really, as you said, our goal here is to control the spread of COVID, reduce the number of transmissions that happen. And that's really to protect both the health system, but particularly the most vulnerable people in the community that have the more serious diseases. So when we get the notification from the lab about a new positive case, we make that call as soon as we can to that individual. And we look backwards in time to see where they might have been infected, where they picked up the COVID, and that helps us to identify super spreader events or other outbreaks that may not have been identified. And that way we can basically go back to those locations or to those settings and try to identify more cases. And then we're looking basically forward to see if there's any people that they came into contact with and they could have infected. And again, the goal is to try to get those people into quarantine as soon as possible so that when they become symptomatic or when they start shedding the virus, they won't be exposing anybody else. So it's really key. It's a way for us to control this spread. And as we go into this new phase of being able to immunize people, increasingly we're going to a point where we're almost able to contain the spread of this virus because there'll be more people that are essentially immune from the vaccine. And so we identify cases and we get after them as soon as possible. We can prevent transmission to those who are still vulnerable. So it's extremely important that we keep doing this work.
Maureen, just coming to you, can you tell us a bit about the recruitment? Because we know that the original contact tracing team is a pretty small team. And what have you had to do to recruit to get to closing like 1,000 cases a day? That's crazy impressive.
So yes, the team started out pretty small. There was probably about 50 case investigators and contact tracers who were working within the CDC team. And pretty early on in the pandemic, that team got overwhelmed with the number of cases that we were seeing. So there was some recruitment of medical students early on for a couple of months until they had to return to their studies. There was a lot of redeployment that happened across the system. And then 3 probably big times of hiring, which was in May and in the summer, and then again this fall and over the winter. And we're still doing some hiring. So we went from 50 to a team of about 2,437 now, I believe, as of this Friday. So that's a tremendous increase. And that has been a lot of work on the part of our HR partners, as well as our managers and staff who've done the onboarding and the hiring, as well as all the educating and training and mentoring of that staff so that they're able to do the case investigation and contact tracing work. And as of this Friday, we will have the capacity to do 2,000 case investigations per day.
Thanks very much, Maureen. So David, coming back to you, we know that the new COVID-19 cases have been trending downwards. So just interested to know, how has that affected our contact tracing efforts?
As Maureen said, we've been staffing up significantly. I just also want to take the time to just thank all those staff for the work that they've been doing. And we've hired a lot of non-regulated staff as well, and the people that have been managing them have been doing an outstanding job of getting them ready to do the work they're doing. So as our numbers go down and case numbers go down and our capacity goes up, we're able to do additional amounts of the other functions that I was talking about before. So things like monitoring people while they're in quarantine and isolation. So that means calling them during that 10-day period for the people that are actually COVID positive, and for that 14-day period for their contacts, just to make sure that they're safely isolating, that they're doing okay medically, that they're getting the supports they need. And if necessary, we can actually refer them on to some additional supports in the community to help them stay in quarantine and isolation safely. So as our numbers shift around, we can modify that. Again, our emphasis is on the case investigation part. We're keeping up, more than able to keep up with that right now. So we can reassign people to those other roles, and including, we actually have people helping with the outbreaks that are in acute care and in continuing care to support that work too. So we are pretty fluid in being able to reassign people to the different roles within the program.
Maureen, we know that COVID has actually made us sort of think outside the box on many of the things that we're doing. And I know that within contact tracing, you've actually brought some innovations in how we do it. So wanted you to share some of that with us.
So absolutely, over the past year, we have been very creative and innovative, and we've done a lot of quality improvement, a lot of process improvement. So there's been some great work that has emerged out of this, and some of it that will probably extend past the pandemic. There's been a lot of collaboration with our IT department and with AHS Webcom and with other stakeholders such as HealthLink to create some really great innovations around, for instance, the online booking tool for people to book their tests, as well as the auto dialer. And that started early in April last year. So people could receive their negative results within an hour of them being available from the provincial lab. And then later, early in September, there was the auto dialer and the SMS texting for positive and negative notifications. And previously, the CDC team was doing all those notifications to the positive cases. So this really saved us quite a bit of time. Then in early November, there was the web portal that was created. And so when a positive case received their SMS text notification to say they were positive, they got the link to the web portal. And prior to being called from the case investigator, they could put in all their close contacts. And then when the case investigator called them, they could verify, yes, these are close contacts, and maybe there's a few more, or maybe some weren't. So once those were verified, then that text could go out to all of those close contacts, and they would be notified right away that they needed to quarantine, and then they'd be provided with further information and where to go for more supports. So all those innovations were tremendous in saving us a lot of time and being able to redirect our staff over to case investigations.
So David, coming to you, I know that we all are anxious about the new variants of concerns for COVID-19 and the fact that it's more infectious. So wanted to hear a bit from you about what are we doing differently with contact tracing for these variants?
Yes, it's a really important issue. So as you said, these variant strains are known to be more contagious, spread much more easily. And we are in a position where we can maybe contain them. More likely, it's still just aggressive control. So what happens is that we get the report from the lab about the initial report saying that they're positive for COVID. So we do our initial case investigation, as I described, and getting the contacts, et cetera. Then within usually 24 to 48 hours, we get the report back as to it's a variant strain. So we call those people back and we do a more extensive interview with them just to make sure that we didn't miss any of those contacts, and also trying to, if we couldn't before, establish where they were infected, because again, that could be in a potentially in a congregate care setting that we may not have identified that there's an outbreak going on, for example. So that allows us to get a jump on those potential outbreaks, and a much more aggressive approach would happen in those settings. So we do. We also do go back and interview the contacts again once it's identified that the case is a variant case, just again to make sure that those people are isolating, are quarantining at home, not out in public, and potentially spreading that virus further.
So Maureen, one last question for you. We know that building strong community partnerships is something that we always strive for in AHS. So just wanted to ask you, how has this benefited our contact tracing?
Thank you. That's a great question. And absolutely, partnerships are so important in terms of the work that we've been doing. We've been collaborating with stakeholders both internally and externally to AHS, and there's been some incredible work. And when we talk about saying that it takes a village to raise a child, it also takes an entire province to stop a pandemic. And so we've been creating some great partnerships both internally and externally. So towards the end of wave one, we start to notice increased outbreaks in workplaces, in schools, at sporting events and large gatherings. And so we created a set of tools and protocols and templates that we could then use with those areas like workplaces and sports events and large gatherings. So we would work with those leaders and organizations to assist us with notifying all the close contacts of a positive case, and they would send out letters and notify them. And this would then just extend our reach. So they were able to do that much quicker and faster, and all these individuals would be notified. So with schools, we worked with Alberta Health, Alberta Education, and school jurisdictions, and there was a task force that was struck early on so that we could create resources and tools for both parents and schools so they would know what to do in the case of having a COVID positive student or staff member. So now when we determine that a case is infectious at school, we have a whole process that we followed, and we work very closely with the schools to refine this process so that it meets their needs. And we have been receiving really positive feedback from our school jurisdictions as well as from the Minister of Education on the process. So we're really pleased with that we're able to have worked with them and to be meeting their needs throughout the pandemic, and will continue to do so. So I just want to mention that the CDC team has just been amazing to work with. There's been some incredible work that has happened. There's been some pretty big mountains that we've all climbed together along with our partners and our stakeholders. And this team has continued to rise to every challenge, despite how tired and exhausted they may have been at times. They have just been incredibly dedicated, and none of this work could have been accomplished without all of them.
So thanks very much, Maureen and David, for coming on our blog today. Really impressive to hear everything that's been going on with the contact tracing team. I just want to thank you and your leadership, and please give our best to everybody who's on the team. As of February 26, our current workforce, as Maureen had mentioned, is over 2,400 case investigators and contact tracers, which is approximately 49 times higher than our original team of 50 contact tracers back in March of last year. By March the 5th, the team will be able to investigate over 2,000 cases per day. This does not include COVID-19 variant cases, which, as you know, requires additional time. As we continue to hire, train, and onboard staff to increase case investigation and contact tracing capacity, as well as regularly assess our recruitment needs based on the evolving needs of the pandemic response. And with our expanded workforce, technological innovations, enhanced case investigation capacity, and ability to call close contacts, with the help of Albertans, AHS will be able to meet the current and future demands for contact tracing in our province. This work is so important in preventing the spread of COVID-19 in Alberta, and I'm so proud of everyone involved. So thank you to everyone across AHS for your continued work in responding to the pandemic. We know we wouldn't be here and that we wouldn't be able to do any of this without you. So thank you, and we'll see you next time.
Together, we do amazing things every day.